Good morning. I started out the day at G.N. Smith Elementary School this morning talking about another job that I have, and that is State Fire Marshal. Besides being Insurance Commissioner, I happen to be a State Fire Marshal. Now, how many of you know what to do if your clothes catch on fire? Raise your hand. All right, what do you do? Now, Neely Carlson has it. Stop, drop, and roll. That's what you do if you catch on fire. So, we deliver to these children fire hats. And due to the Breast Awareness Week, I want to present this to my good friend, Commissioner Sidney Hyde Smith. Come up here and you can wear this. Now, it's important that you understand what I do as State Fire Marshal. Besides an education program of trying to teach children about fire, we also investigate arsons in the state of Mississippi. We train over 16,000 folks at the State Fire Academy, which we're responsible for. We also enforce codes in public buildings, and that includes things like the new stadium at Mississippi State University. We are also responsible for fire prevention training. All of these things go along with the things that we do as fire marshal. We also inspect all the manufactured homes that are installed in the state of Mississippi. Most of you probably didn't know we do that. In addition to that, we have the Rural Fire Truck Program, which reduces insurance rates for folks that live in rural areas. But besides being a fire marshal, my job as Insurance Commissioner deals with things like property and casualty insurance. What we're seeing today with Tropical Storm Hurricane Sandy, what's happened on the East Coast. It happened to us here with Katrina. It's important that you have available and accountable and affordable insurance in your state if you're going to have an economy and you have a population that lives close to the coast. Our prayers are with those that are suffering for Sandy. I want you to understand that we've sent people from Mississippi up there to help. Besides homeowners insurance, I'm also responsible for things like liability insurance. So I want to talk to you very briefly, and this is probably the most important thing I'm going to tell you today, about what's about to happen next Tuesday. The most important race that Mississippians will vote on Tuesday, if you've not already voted, is that of Supreme Court Justice. You probably thought I was going to say the presidency. The most important race for decades to come in Mississippi is the Supreme Court races in the 3 districts that we'll be voting on. You're looking at me and saying, why? It's important that we have a balanced court in the state of Mississippi. You cannot have a court that's too far to the right or too far to the left. You must have a balanced court. If you have a balanced court, you can maintain some sanity about what happens in the system and what happens on liability insurance. Let me give you an example. For years, and I do mean years, as a businessman, I worried about the lawsuits that we had that were frivolous. When I became a member of the legislature, after winning the election in '92, my first priority was to work on tort reform. It took until 2002 before we had any meaningful tort reform other than what we passed in '93 and '94. And then in 2004, we had more tort reform. This is what happened to insurance rates for medical malpractice. In the early '90s, rates went out of sight. After we passed tort reform in 2004, we've had a 90+% decrease. I want to repeat that, a 90+% decrease in tort claims and insurance rates for doctors in the state of Mississippi. That's just at one company, at Macomb. Just as the Mississippi Economic Council's blueprint has determined that the healthcare industry is the future of our state, and have included things like rural access, medical training at the medical school, all of the things that we need to do to have affordable medical care in this state, including lowering and fixing some of the regulatory barriers that we have for health care. I have addressed that issue at the Department of Insurance by looking at what we do for health insurance in this state. Now, we don't really regulate health insurance to the degree that you might think we do, but what we do is this. We control what is offered on the plans. And to that end, with the exchanges that have coming up and mandated under the Patient Protection Affordable Care Act, better known as Obamacare, we're doing what we think we need to do for the state of Mississippi to operate the exchanges that are mandated under that law. I think the worst thing that we could do in the state of Mississippi is to kowtow and defer to the federal government to run the exchanges. The options are very clear. I can do that, or I can take a position that may not be popular with some people and operate the exchange as a state-based exchange. The reason for that is pretty simple. As a state-based exchange, we can mandate the benefits that are offered, or what we call essential health benefits, on the exchange. And those benefits are the same as what you would have in the largest group carrier in the state, offered by Blue Cross Blue Shield. If we let the federal government determine the benefits, you may have 46 or 70 or 80 mandated benefits that would break the state of Mississippi. One, the feds will determine what you do, and number two, they'll bill the state of Mississippi for all of that cost. By doing it as a state-based exchange program, you control what's offered on the exchange, and you also control the regulation and the people that sell off the exchange. I don't know what's going to happen on the presidency. I would make a prediction to you, but I can tell you this. Even if Romney is elected and he doesn't carry the Senate, so you have one body that's Republican and a presidency that's a Republican and a Senate that's Democrat, we'll be in deadlock for several years. There are things that can be done to manage the money, but there's not a lot that can be done to change statutory law until you have some compromise by both chambers in Washington. I predict that Romney's going to win the presidency by a narrow margin of somewhere between 271 to 282 electoral votes. It's going to be a tight race, and you may not know who the presidency is going to be for 17 or 18 days. But the law requires that the state of Mississippi, if we're going to operate an exchange, must submit a blueprint before the 16th of November. I want to tell you that we will probably submit that blueprint regardless of who wins after the 6th of November. We have the authority to do so at our office. We have the authority to submit the blueprint. It doesn't require anybody else's approval because I happen to be one of 11 elected commissioners in the United States. There are not many of us that are elected in the U.S. I happen to be one of them. To that end, we have a leg to stand on if the federal government changes the rules or if Romney is not elected. We have a leg to stand on in a court of law to actually talk and say that we don't agree with the feds, and we can address that in a court of law if we think they're out of bounds. I'm here to serve the people of the state of Mississippi. I consider it an honor to be your insurance commissioner. I truly love my job. Most of you probably know that I'm over 65. I may not look it according to some, and my wife thinks I look 80. But I want to tell you why it's important that you know that, because I understand what's going to happen, that if the Affordable Care Act remains the law of the land, money's got to come from somewhere to fund it. And that money's coming out of the monies that you and I have paid in as taxpayers since 1965 for Medicare. There will be over $700 billion taken out of one pot of money and put into another to fund the Affordable Care Act, in addition to another $500 billion of taxes over a 4-year period. Now, what do you think is going to happen to people my age? With no money to fund Medicare, there are going to be less providers and less people to provide help in the form of health care to those folks that are 65 and older. It's a concern of mine, so I have a dog in the hunt, you might say. We will be there to work for all the people of this state, regardless of who wins next Tuesday. I want you to know that we always take in mind the 2.9 million citizens of this state when we make decisions. We don't shoot from the hip about what we do. We try to make intelligent, informed decisions that benefit all the citizens of this state. Thank you for letting me be here today, and thank you for letting me serve as your insurance commissioner.